So hello everyone, good afternoon. Hope you all are doing good. So in the last session, I talked about how oral health affects the overall well-being of a person. In today's session, I would be talking about the right method of practicing oral hygiene. I'm stressing on the word right because we all know how to brush our teeth. Few of them also know how to floss our teeth. I'm not saying all know flossing. Few of them know flossing also. But do we know the right method of doing it? No. We just know how to brush it. We take our brush and start scrubbing. So that's not the right method of brushing. So today I would be discussing how to brush your teeth properly so that our goal is achieved. So what is the goal now? The main aim of our oral hygiene practice is to remove something that is called plaque. Plaque is a soft, thin film of bacteria that forms over our teeth. Usually it forms at the gum line, that means where the teeth and the gums meet. At that edge, the plaque is formed. And it usually forms say 4 to 12 hours after we eat our food, after brushing, okay? So 4 to 12 hours after brushing, this plaque is formed. So when you get up in the morning and if you just roll your tongue all over your teeth, you feel that sticky substance, you feel that fuzzy sensation. So that is plaque. Okay, so plaque is actually the enemy of our teeth. When we eat our food, the leftover food gets stuck up over our teeth. I told you the plaque is made up of bacteria. So the bacteria in the plaque, they will start feeding on this leftover food, and in the process they produce acids. These acids eventually break down enamel, that is the outermost layer of the tooth. This is how the process of cavity sets in. Eventually, you will develop cavities. Plaque also causes gum diseases. Plaque, I said, is near the gum line. So, the toxins that are released by plaque, the bacteria, the toxins will start irritating the gums. And once the gums are irritated, they get inflamed. That is, the gums become swollen, they become red, and they bleed easily. So plaque causes gingivitis, that is the first stage of gum disease. Plaque also causes bad breath. Like I told you, the bacteria, they start producing acids, they feed on the leftover food. And in the process, they also produce some sulfur compounds. And these sulfur compounds are responsible for the bad breath that we get. That is why brushing the right way is important to remove plaque. Now if plaque is not removed in time, okay, it slowly hardens up to form tartar. It starts taking up all the minerals from the saliva and it hardens up to form tartar. And mind you, tartar, if it is formed once, it cannot be removed by your regular toothbrushing. You will have to visit a dentist who will remove the tartar. So be careful that you do not allow the plaque to get converted into tartar. And plaque usually gets converted into tartar say 48 hours after its formation. So if you do not brush your teeth for 2 days, so your plaque will get converted into tartar, and then it is very difficult for you to remove it easily by just brushing. So you will have to visit a dentist then. And tartar again will lead to cavities, gum diseases. Yeah. So now we know what is our aim of the oral hygiene practices. Okay. The main aim is to remove plaque. So now how do we brush our teeth? We all know our brushing. We just take the brush and scrub and scrub and scrub. But that's not the right way. Okay. So I'll show you how to brush your teeth. Now this is a model of the teeth. When you're brushing your upper teeth, always keep the brush at an angle of 45 degrees facing upwards. For the upper teeth, you have to face the brush upwards, okay, at a degree of 45 degrees, slightly tilted. And keep it partly on the gums and partly on the teeth, okay. So once you keep it at a 45 degrees angle, take it downwards and in short circular motions start brushing. Taking it downwards, short circular motions. And then you can go back and forth also, but there and there itself. No need to scrub it this way. This is the wrong method. You have to go back and forth just there and there itself without taking over the bristles away from the place, okay, there and there itself. Then go to the next, take it downwards and then scrub it back and forth, okay. For the lower teeth, it's the other way around. Keep it tilted at a 45 degrees angle, facing it downwards, okay. So this is how you do it, and then take it upwards, short circular motions, taking it upwards, okay, short circular motions, taking it upwards, and then again back and forth, but again there and there itself. No need of scrubbing. We have to kind of massage our teeth. We don't have to scrub. We are not scrubbing the tiles of our kitchen or bathroom, you know. So be very gentle on your teeth. You just have to, with gentle pressure, you have to brush your teeth. So this is for your upper and lower teeth, how you have to maintain the position of the brush. Now for the inner surfaces of the front teeth, upper and the lower inner surfaces, place the brush slightly vertical, tilted vertical. So for your upper teeth, keep it this way and then take it downwards, with the tip of your brush. You're going to brush just with the tip of your brush, this way, take it downwards. For your lower teeth, take it upwards, this way, okay. This is how you brush your teeth. And we have three surfaces of the teeth. So we have the outer surface, we have the inner surface, and we have the chewing surface. So I repeat, we have the outer surfaces, then we have the inner surfaces, and we have the chewing surfaces. So we have to clean all the surfaces of the teeth. Now one strategy on not to forget any of the surfaces, what I follow is that, and I tell my patients, is that you start from the outer surfaces of a upper teeth, say maybe the right hand side, then eventually go to the left hand side, okay. So start from the right hand side, outer surfaces, go to the left hand side, then come down to your lower teeth, outer surfaces again, follow the outer surfaces, come back to the right side. So now we have done the outer surfaces of both the upper and the lower teeth. Now shift to the inner surfaces. So inner surfaces of the lower teeth, come in the front, go again to the left side, go up the inner surfaces, come again back to where you started. So you've done the outer surfaces, you've done the inner surfaces. Then you start with the chewing surfaces. 1, 2, 3, 4. Okay. So we have 4 chewing sides of chewing surfaces. So you finish off all the 4 quadrants. Okay. This is one way. Another way is just finish off the outer surfaces of the upper teeth. Then go with the inner surfaces of the upper teeth. And then the chewing surfaces of again the upper teeth. Then shift to your lower jaw. That is, brush the outer surfaces of the lower teeth, then the inner surfaces of the lower teeth and the chewing surfaces. So if you follow it in a systematic way, you are not going to forget any of the surfaces. So your brushing is going to be efficient. So how much time should you brush your teeth? Okay. So 2 minutes you are supposed to brush your teeth. So I give 30 seconds for this quadrant, 30 seconds for this, 30 seconds for this and 30 seconds for this. Okay, so 2 minutes you have to brush your teeth, minimum 2 minutes. And when should you brush your teeth? 2 times daily, that is morning and at night before going to bed. Now why is it important to brush your teeth at night? We have saliva in our mouth. The saliva is like a natural defense mechanism. It acts like a natural defense mechanism. So it fights away, it washes away all the bacteria that is present in the mouth. And like I told, bacteria produces acids. So the saliva actually neutralizes these acids. So it makes the harmful effects of the bacteria, it lessens it down. So at night what happens, our body signals these salivary glands to produce less saliva. Okay. So once the salivary flow is less, the natural cleansing action is less, the neutralizing effect of saliva is less. And then when saliva is less, the bacteria become more active and more numerous in number. So once the bacteria become more active, they are like, oh, saliva is not there. Come on, let's start destroying the teeth. And that is where they start eating all the leftover food because we've not brushed our teeth. So the leftover food is there. They start feeding on them and in the process they produce acids and that is how the cavity will start happening. So this is how you should be brushing your teeth. Now, one more thing is that, should you brush immediately after eating? No. You should wait at least an hour after you eat your food. Why is that so? See, when we eat our food, the food and the bacteria, they produce acids. Okay, they leave behind acids and they actually soften the teeth. It's like the acids are clinging onto your teeth. So the moment after you eat your food and you immediately start brushing, you're actually rubbing the acids all over your teeth and you're causing harm to the teeth. So always wait for at least an hour after eating your food and then you brush your teeth. During this 1 hour, the saliva will do its job. I told you that saliva neutralizes the acids. So during that 1 hour's time, the saliva will start neutralizing the acids, and then after an hour you are good to go. You can start brushing your teeth. And remember, once you brush your teeth, do not eat anything. Otherwise, you're not serving the purpose. If you brush your teeth and again you're going to eat or drink something, then it's no use. So only thing that you can have is water. Okay, after you brush your teeth, you can have water. So this is about how you should be brushing and when you should be brushing.